You gotta hear what I have to say. Are you walking around like this? Are you concerned about the coronavirus? If you are, you're gonna wanna watch this. Share, comment, say hi. Hello, Jay. We have some things to talk about. So, grab your favorite beverage, and I want you, your comments make me laugh. And I want you to take notes. I want to hear your guys' thoughts. I want to hear your concern level. So first, as we're starting off, and let me get this shared out. So we can have as much participation. If you are watching the replay or if you are watching on YouTube, drop a comment. Let me know on a scale of 1 to 10, how concerned are you about this virus? Scale of 1 to 10. I'm going to share this, and then we will get to talking. And I'll take off my costume. So guys, one of the things I didn't anticipate is how hot this mask is. Okay, we're all shared out. Hello, hello, thanks for joining. Hi, Jackie. All right, so if you didn't hear yet, on a scale of 1 to 10, how concerned are you about the coronavirus? And while you guys are dropping those comments, I just want to make a side note. We did not go out and buy these masks. You don't need to go out and buy masks. We already have these masks. So it is what it is. Let me take this off because I can't even, it's really hot, these masks, let me tell you. Whew. Not a fun thing, so you don't need to be wearing them. I wouldn't be worried about that. Now it's stuck in my hair. Take these off. Oh, the real life of long curly hair. Hold on, there we go. All right. Hi, Jackie. I fixed my hair the way that I liked it without all these little flyaway things. And then it just came right off, right? Such is life. Okay, so I want to talk to you guys about the coronavirus, COVID-19. There's been some breaking news this morning, and just for context, I live in Washington State. As of this morning, there have been 4 additional deaths in the U.S., bringing the total to 6 deaths from the coronavirus in the United States, all in Washington State. I live in Washington State. I live on the opposite side of the state, but still the state. Also, so I'm going to give you some of my personal experience. I'm going to talk to you about the World Health Organization, and then I'm going to talk about how it relates to thrifting. So that's where we're headed today. So a couple things. We live in the state where all 6 people who have died in the U.S. died. Also today, from a few hours ago, the last I've seen, there have been 5 new states that have cases: New York, New Hampshire, Rhode Island, Florida, and Illinois. So it was the majority of the cases were on the West Coast. You had all the people that came back from the cruise ship who were they were repatriated from the cruise ship to California. So I think like 39 cases, don't quote me on the numbers, were in California. Most of them were from that cruise ship. We also had, even closer to us than the ones that are in Washington State, we live in Washington State, kind of on the border between Washington and Oregon. So we're very close to Portland. Lake Oswego, a suburb of Portland. A teacher contracted the virus, so schools are shut down. Not all the schools, but some schools, especially the elementary school where this happened. And that's only, 25, 30 minutes away from us. So We got cases 30 minutes south of us. We've got cases about 6 deaths, and other cases about an hour and a half north of us. So we're kind of in the middle of this. So I wanted to talk about how we're feeling, our level of concern. We also attended an event in Tacoma, Washington with, this was just 14 days ago, 2 weeks ago, with 17,000 people in an arena. And the majority of those people came from Seattle, which is where where these deaths have happened. So some of those people that we were interacting with could have had the virus. So it's, fairly, I won't say likely, but there is a possibility based on our interactions that we could have been interacted with people who are carrying it. So that gives you some context of this, the level of closeness to home. Like, we're not, obviously don't know anyone personally. Hopefully nobody we know personally gets affected and they can get it under control. But it is a hot topic in the news, and it got me thinking about sourcing. We went sourcing, today's Monday, we went sourcing Saturday, and we did discuss pulling out our masks and wearing them sourcing. But here's the thing about masks. So let's jump in. The disease is spread by droplets, which means you're talking spit, snot, saliva, whatever. I'm not a medical person, so, take that with a grain of salt, and I'm not going to probably use the exact accurate terminology. But I do know some things. The mask that you see nurses wear, just the regular blue masks that go around your ears, those are not going to protect you, so there's no point in even wearing them. Those protect other people. If you're infected, like if you have a cold or the flu or coronavirus, they protect your germs from getting to other people. They don't protect other people's germs from reaching you. So those masks that go around your ears, and the blue ones without the respirators, not so much. This is it's called an N95 mask. Don't go out and buy them. Again, we have these on hand, but it has a respirator on it. It goes around your head and it creates a seal. Like, it actually seals around your jaw and everything. Not like sticks to it, but you get what I'm saying, versus the other ones that are kind of loose. That's the only thing that's going to protect you. You only need a mask if you're actively dealing with people that have the virus. So there's no reason you would come in contact directly with any person, so you don't need this. Let's start there. So the best thing you can be doing is washing your hands with soap as much as possible, soap and water, and avoid hand sanitizer. I recommend avoiding hand sanitizer. I know they said or use alcohol-based hand sanitizer, but from my understanding, it breaks down the membrane in your skin and actually makes your skin more permeable to germs and bacteria. So just use soap and water as much as you can. Avoid touching your eyes, your nose, and your mouth, your face in general. Avoid anyone who seems slightly sick. If you know anyone who's sick, tell them to stay home, spread this for sure. And then I also this is all tips from the World Health Organization. If you have a fever, cough, or difficulty breathing, seek medical attention, but do not go to the emergency room or to urgent care or into your doctor's office. Call first, because you could be doing more harm than good, because you could be bringing your disease to other places that are trying to treat people and infect more people. So if you call in advance, they're gonna, and you should be telling other people this should be common knowledge, meaning we need to spread it so that it is common knowledge. If you call in advance, they can set up proper care for you, or tell you where to go, like the actual best place to go. So you would want to call in advance. You don't want to infect more people. So, and then obviously cover your mouth into your bent elbow, no hand coughing, gross, and into your bent elbow, which, does anyone really cough into their hand anymore? Although I did see on SNL over the weekend, they called Pete a hand, like Bernie's character on SNL, the guy who plays him, was making fun of Pete for being a hand cougher. So if you're into political humor, you might want to watch that. It's funny. It's on YouTube. Okay, so related to sourcing, you don't need a mask. We are still sourcing, despite, and actually where we source is even closer to this school where this infection happened, we're still sourcing. We are not wearing masks, but we are using gloves. We're using gloves and not touching our face basically while we're there. I would use disposable latex ones and then throw them away as you're leaving. We always wash our hands when we leave the bins anyway, because we got to drive back 25 minutes and, you know, we're touching inside the car and stuff like that. So I would bring disinfecting wipes and gloves. I would wipe down the cart that you're going to use, and then obviously use the gloves, which you might already be doing. Some people at the bins use them all the time. We don't, because we like to feel the stuff that we're buying. What else was I going to say about that? Oh, so wash your hands with soap as I touch my eye. If you have kids, I would probably leave them at home as much as possible. Here, like I said, because of the outbreaks to the north and to the south, they've actually canceled a lot of sporting games, like basketball games and whatever sports are going on. They've canceled some like children's school games. You know what I'm trying to say. But I do want to say that the virus is likely to not stay on clothing. The World Health Organization is even saying that like packages and mail from China are safe, because the virus isn't gonna survive very long on a package or a piece of mail, like a letter. So my assumption would be if it can't stay on that very long, it's probably not gonna stay on clothing very long. What it does stay on is hard surfaces. So you could wipe those down with wipes. And then as far as washing the clothes, you can if you want to. We didn't wash the clothes that we brought back. Again, our level of concern is cautious, you know, but not freaked out. So we're taking a little bit of extra precautions like gloves. We're washing our hands a lot. Like we got a return today, and when I picked it up from outside, I washed my hands immediately after. So we're just washing our hands more and then wearing gloves while we're actively sourcing. That's what we're doing. What do you guys think? What are you guys doing? Do you have any cases in your state? Are you still sourcing? And so the questions you would want to ask yourself are, you know, if you're nervous, if you're on high alert, can you afford to not source? Can you afford to not have any new inventory for a while? Like, can you float your business until you feel comfortable again? If it's going to get worse, you know, it might be worthwhile to stock up on some inventory now, like buy extra so you can go out less, you can source less. That would also be an option. But also, can you afford to source? If you have young children, or if you live with someone who's elderly, can you afford to be out in the public, you know, whether it's the coronavirus or the regular flu, to possibly infect, you know, the people you live with, the young children and elderly people? It's definitely something. So can you afford to, or can you afford not to? It's going to depend on your situation. Or can you alter how you source? We go to the bins, which is very open, and there's a lot of movement and a lot of people, and everyone's touching everything, and you know, it's a lot of community opportunity for community transfer, I guess. Could you maybe source online? Maybe you've been wanting to like check out online wholesale. Can you pick up some wholesale lots online? Can you buy a pallet? Can you even just source other eBay sellers and their low auctions? There's a lot of eBay sellers who will put low auctions on things. Maybe you can be a bidder on those and get the inventory you need that way. So just some things to consider. I definitely want you guys to stay alert, but I thought that this was a timely time. That sounds funny. To talk about it, especially with, you know, the death toll, literally. I mean, it's small numbers, but their lives are ended over this virus. And so the death toll has tripled this morning from 2 to 6 in the state that we live in. So, you know, there's definitely some concern. Like I said, we've come in contact with people who live in that area in the past 2 weeks. So yeah, we'll see what happens, and I'll keep you guys updated on if anything changes with us. So let me know, are you guys still sourcing? Are you nervous, concerned? What are your thoughts on all this? overblown conspiracy theory. I mean, we could have the range between like people that are really freaked out and ready to like hermetically seal themselves in their own bubble, and people who are like, this is a conspiracy, and maybe, who knows? I don't want to throw around too many conspiracy theories, but let me know what you think. I'd love to hear your thoughts. Those are our thoughts actually living in and around the area that it's affecting a lot. But I think that's everything for you guys. Yeah, so have a great day. If you haven't, like our Facebook page, leave a review. This month we will be doing a 3-day challenge, public free challenge. If you want to get in on that, if you want the details, drop a comment below. I will reach out to you. I will also post a link below to the World Health Organization article so you guys can read their tips yourself on how to stay alert. All right, guys, I will catch you next time. So yeah, like the page, subscribe, do all those things, share if you feel called to. We'd really appreciate it. Talk to you guys soon. Bye.